So you don't have to answer the question. I've done it multiple times. You look for the buzzwords and use the buzzwords to rewrite the question, focus on those buzzwords, and come up with your content to answer the question. Which of the following indicate correct understanding? Is correct. People always get confused. That means they have to say something good of the teaching. And next, provided teaching to a client, prescribe what? 2 grams of sodium diet restriction. What is the buzzwords? Due to hypertension, right? So 2 grams of sodium diet. That means you have to stay within the 2-gram restriction. And what is the question asking you? Correct understanding. Which of these shows that they understand what the 2-gram is? The way to answer this question, think about it. 1 teaspoon is about 2.3 grams. That means whoever the patient is should not eat more than 1 teaspoon. Avoiding salty food is not enough. You cook, right? You eat, you drink, you do a lot of drinks, you drink so many things have sodium in it. So most of us, salt is from things that we eat. Salt during cooking is allowed. That is more than 2 grams. Even a pinch will add more to that. No processed food, this is good. Canned vegetables, that's where most of your sodium is coming from, or meat, and salt during cooking, or avoid salt substitute. Test taking skills, right? If you avoid salt substitute, that means you're not taking potassium. Therefore, you're going to take regular sodium. Therefore, your sodium is going to be high. Just avoiding salty food is not enough. You are not allowed to add salt when you're cooking. So that makes option 3 is where most of your salt is. So when it said 2 grams of salt, yeah, no processed food, no canned vegetables, no meat, and no added salt during cooking. Okay, so that's the first one. That's the key fact. So when they tell you 2 grams, that's what it means. Number 2. And this is caring for a client with what? Bulimia. Which of the following is a priority that must be included in the plan of care? These questions are always confusing and trappy, but you don't have to make it that hard. The key word is what? Bulimia. I know you will say, oh, this is anorexia. I'm just using the content. What is the biggest between the two of this? Anorexia, they don't want to eat. These people, I will eat, then beg, so that I can vomit. So what do you think these people use? A bunch of laxatives. That is the key. Anorexia people, they limit their intake. They are very regimented. They cut their food, small food. Bulimia will binge. They will eat everything you give them, and then they will perish. That is the key you have to use to answer this question. Providing journal is good for both of them. It does not change anything. Priority, that's not your priority. Monitor for regimented eating pattern. That is more common with anorexia. These people, they're going to, whatever food you give them, they will eat. But guess what? They'll take something and let them go without knowing you being aware of. Diligent evaluation of laxative possession. A 1-to-1 see that during May time. I told you, they're going to eat. This is the people you give to anorexia. They're going to eat the food you give them. But when you leave, they take their pill and then all the food come out. So the best thing to include in bulimia patient is to make sure they don't have possession of laxative that they can take when you are not around, and then they will have bowel movement. That is the key. But all of this is fine, but priority is this, because of the difference between anorexia and bulimia. Number 3, and try to be fancy, right? Which letter selected by the client on the diagram indicate correct understanding of the teaching? And next is providing preoperative teaching to a client scheduled for what? Descending colon colostomy. Which one indicate that? Look at the diagram. Even if you don't know, this doesn't look like it's descending, it's going up. So this is ascending. This look like a T. This is transverse. This is descending. But the descending will end here. This becomes sigmoid. So this is sigmoid. This is descending. This is transverse. And this is ascending. So for descending colon is the B. Number 4. What is the next best response? A client presents to the emergency with acute what? Asthma, exacerbation. The client politely asks the nurse for a cup of what? Water. Kid is sick, asks the nurse, give him some water. What would you do? What will you do? What do you think the nurse should do? If you are the one, what do you think the nurse should do? Will you give the kid water? I will get you something to drink after your virus. Why do you want to drink? I'm sorry, your condition does not allow for water at this time. Water can kill you. Do you want to die? Therapeutic. But look at the situation. Asthma exacerbation. What do you want to do? If you don't know the answer, eliminate. Why answer and take it out, right? Water can kill you. That's not what he's asking. You're being cheeky. Now you're left with 2. Do you give it check the virus and give the kid drink? Or you tell them your condition does not allow? You got to be truthful. You got to be safe. If you give this kid water and aspirate, you are in trouble. Tell the patient the truth. You dying. No water go into your airway at this time until we figure out that you're doing okay. So that's your right answer. This is something you have to know. Sometimes it may be one of those teaching kids you have never seen before. Which of the following the nurse should include for the food groups? A nurse is providing teaching to a client with diabetes about food groups and exchange list. I know some of us, we know, I mean, some of you know already. I mean, diabetes patient, you have to teach them. There's food classification. And this is the 6th food classification, American Diabetes Association. This is what they use. And they classify the food and they put certain food in that list. There's a milk group, there's a vegetables group, there's a fruit, there's a starch, meat, and fat. These questions are, most of them are nutrition. I think nutrition is very confusing. That's why I'm based on the last one, so nutrition. These are all food classification for the diabetes patient. Meat here, egg is included. So egg is considered as a meat for them. So you should look at the diagram. You can Google, it will list all the food classifications so that when you're educating the client, you can give it to them. But all this is part of the food classification. Since now you know what is the food classification, this is the question I want to focus on. The same thing. You provided the teaching, right? After a nurse provided teaching to a client with diabetes on food group and how to indicate correct understanding. So how should the nurse exchange? Which of this you can exchange? What it means is if there's a class of food in one group, like meat, you can exchange one to another. You have to stay within the same group. So in order to answer this, you have to know what group tomato belong to. Then you can exchange it. So what do you think? What does tomato? Is he a milk? Is he a veggie? Is he a fruit? Is he a starch? Is he a meat or fat? And then you look at the answer choice, then you can exchange it with each of them. So what do you think? What do you guys think? What should be the correct exchange for this particular problem? You have a tomato, you have diabetes, you don't want it. So what would you exchange it to? Wheat, broccoli, banana, or beef? So tomato is considered a veggie in the group. So since it's a veggie, you just exchange it with a veggie. And then broccoli is a vegetable. So that's banana is it's a fruit. And the rest, this is all corn and this is beef. So that's how you can exchange it to that. So the correct understanding is to choose number 2, which all of you got it. Number 7. A nurse is providing teaching to a client with what? Severe diarrhea. Which of the following teaching is appropriate? Try to void every time you have the urge, increase caffeine intake, minimize anxiety and anger, or high fiber diet. What do you think? Buzzword is what? It's one buzzword, severe diarrhea. Which teaching is what? Appropriate. That means how do you prevent your severe diarrhea? These single, straightforward questions, you can see most of them, like that's the way, one-line question require you to think and bring your content. Severe diarrhea. Which of these answer choice will help prevent severe diarrhea from this patient? What do you guys think? Tell me. What would you choose? Let them void whenever they feel like. Increase their caffeine intake, or minimize their anxiety and anger, or eat high fiber diet. What do you guys think? Help me out there. I need some help. No answers so far. What do you guys think? How do you prevent severe diarrhea? Severe diarrhea, what do you think? The key is, if this is your GI tract, anything that will increase motility is a wrong answer. Therefore, which of this will increase the individual motility? If you increase my motility, you give me diarrhea. If you tell them to void every time they will go 200 times a day. That's like not good. I told you about the cat, right? Caffeine, alcohol, and tobacco, they are stimulants. They speed things up. So this is wrong. Your psychology play a role in your GI tract. That's why a patient with what? IBS, we treat them with antipsychotic, antidepressant, because it's anxiety and psychotic manifestation will increase, will present like diarrhea. So this patient, anger management, anxiety will calm them down. So this will help. High fiber diet will speed things up. So they minimize their anger and their anxiety. Number 8, this is also content. Which of the following teaching the nurse should recommend? A nurse is providing teaching to a client with what? Hepatitis, right? Hepatitis. What would you recommend for me? You give me what? High protein, low calorie, adequate carbohydrate, low protein, low calorie, low carbohydrate, high protein, high calorie, adequate carbohydrate, low protein, high calorie, adequate carbohydrate. These are content. These people, they always have fatigue. They're tired. So what do you want to do for them? They're always tired. And what they need from you is some strength. So hepatitis patient, the diet for them, they need a lot of proteins, high protein. They know, like kidney patient, that protein, they should have high calorie. Most of the calorie, they should have adequate carbohydrates. And these carbohydrates will prevent them from using too much protein and fat. So for hepatitis patient, give them this diet. They don't need low protein. They need a high protein, high calorie, and adequate carbohydrate for them. So that's what they need. They have no problem breaking down. The liver, it doesn't work. You can't make protein anymore, as you know, right? So provide them some protein. So 3 is your right answer. Nutrition, like I said, nutrition I think is very confusing. So there's a bunch of facts. It's all fact answers you have to use. Same thing like this. Which prescription below the next should what? Question. The nurse is caring for a client with what? Sjogren syndrome. 2 words. Underline 2 words. Question and Sjogren syndrome. Then you have to bring your content. This thing affects salivary glands and sweat glands, basically apocrine glands, and therefore lack of secretion. Things dries up in this patient. So which order you see that you have to question it. And you have to know the reason why you got to question it. Which of these I have to question when I see it? If she has Sjogren syndrome, right? Which one will you question? What do you guys think? What do you think? Your mouth is dry. If your mouth is dry, you need sugar-free candy. Your eyes is dry. You need artificial tears. Drinking a lot of water is going to hydrate you. You recognize this medication, diphenhydramine. It has anticholinergic effects. If you give it to them, your eyes is going to get into trouble. Your mouth is going to get into trouble. You will dry things up. Therefore, this one, I have to question. It's just content. There's nothing to it. So if you need some help, check out that link. It's a lot of free resources for you. Which of the following teaching is appropriate? In this case, you got to know your buzzword. A nurse is providing teaching to a client with what? Dermatitis, chronic diarrhea, and dementia. The nurse knows that this condition is related to dietary deficiency. Which of the following teaching is appropriate? I've given you all. Dermatitis, diarrhea, and dementia. I call it the 3 Ds. There's a condition where you have 3 Ds. I know what you have. You tell me you have skin rash, you have a lot of diarrhea, and you're a little bit slow mentally, acutely, it's because you're lacking certain vitamin. What is that? Even if you don't know, you can figure it out. You know, vitamin A is mostly vision, so that is gone. So now 3 more vitamins. What do you think? 3 Ds: dermatitis, diarrhea, and dementia. It's a classic board question that you have to know. It's like 3 Ds. The 3 Ds: dermatitis, diarrhea, and dementia. The disease process is called Pellagra. You figure out what is the problem? What vitamin is the kid, the client is lacking? Vitamin A is for vision, so it can be. What vitamin deficiency will lead to pellagra? Diabetes, diarrhea, and dementia. This is a neurological problem. Balancing ataxia. This is all balance problem. This is B1 is timing. Due to confusion, alcohol overdose. People who drink alcohol, they have timing deficiency. This is B3 is niacin. niacin, and you have pellagra. So deficiency of niacin will give you pellagra. You have like flushing your face, all those signs and symptoms. But this is the problem: diabetes, dermatitis, diarrhea, and dementia is pellagra due to niacin deficiency. This one is the hardest of all. If you know it, it's good, but it's a hard question. This one is also, if you know it, straightforward, right? What is the next best response? A nurse is caring for a client with BMI of 20, 23. The client wants to know the weight classification of the BMI. So where do you put this patient? Is he underweight, normal weight, overweight, or obese? Which one? What do you think? It's 23. You have to know your BMI so that when they give it to you, know patient is overweight or underweight. We always overlook it, but you have to know the range. Is this patient overweight? I will give you the answers. This is the first group. This is the second group. Third group. So where does he go? Everybody say it's normal. Underweight is less than 0.5, 18.5. Overweight is 25 to 29, and obese is greater than 29. So I guess I got to go to the gym then. But that's the way we classify them. I know where I belong. I think I got to go to the gym. Okay. 4 more questions, then we're done. These are all concepts. I'm not making anything that is the same thing you know already. I just make it a question just to refresh your mind. Things like it's very important, you see them shows up. Which of the following dietary teaching is appropriate? And next, provide discharge teaching to a client with what? He has a severe burn to the lower extremities. Which dietary teaching is appropriate? I'm going to guide you. The patient has burned to the body. He has a burn to the body. The client is burned, right? It's burned. What dietary would you give them? Key facts. They have to heal. What is needed for healing? This is how you break down the question. Healing need protein. Healing need vitamin C. Healing need vitamin D. Do you see vitamin C, vitamin D, and protein there? If it's there, that's your answer. This kind of nutrition question, that's the way. Try to break down the question before you look at the answer. Otherwise, you're going to get it wrong. They all look the same. You have to keep on thinking, wasting your time. It will raise your anxiety. Figure out the answer before you look at the answer choice. I broke it down. I know I have burn. I need to heal. I need some protein. I need vitamin C and I need vitamin D. I look at the answer. There's a lot of starch here. It's gone. I don't look at the rest. I see some milk, but too much starch. Oh, I have some protein, milk, and vitamin C. You get your answer there, right? This veggie, I don't see a single protein here. Test taking strategy, right? This is the same thing. A little bit confusing, try to make it easy for yourself. Which of the following diets the nurse should include in the meal plan? A nurse is caring for a client who now claims to be what? Lacto-vegetarian. He said, is a he or she lacto-vegetarian? Remember, there's 3 classifications. There's vegan, lacto-vegan, there's over-vegan, Then there's a lacto over. The way I do it is I write what the vegetarian don't eat. Then if you have lacto, I just add plus. You are allowed to eat. Lacto is milk. Over, you are allowed to eat egg. Lacto over, you allow plus egg and plus milk. That's all. So he says a lacto vegetarian. So he shouldn't eat anything that vegetarian eat except adding what? Lacto to it, which is what? Black. That's all. So the only thing, this one is a pure vegan. This one, vegan, plus he can eat egg. So it's over vegetarian. A vegan dairy product is allowed, so it's a lacto. This guy can eat egg and dairy, so he lacto ovo vegetarian. That's the way you do this. So this is number 3. You have to break it down before, otherwise you get confused. I told you it's all nutrition. And I'm taking key nutrition stuff I think is testable and I'm putting it together. And this is caring for a client diagnosed with what? Celiac disease. You know it, right? Which of the following diets the nurse should include in the meal plan? So if you acing these tests, that means you're doing well. You know the stuff, you know, you don't have to panic. Just keep on preparing. Celiac disease. Therefore, I tell myself, what can I eat on celiac disease and what I cannot eat on celiac? What do you guys think? Help me out there. I need some help. What can I eat on celiac and what I cannot eat on celiac? So which one is the right answer? Wheat, bread, and rice, oatmeal cookies, potatoes, barley soup and rice, mashed potatoes and corn. So what should the nurse include in the diet? You know this formula already. Brown and this, I call it rest in peace, bro. So rice, the I is the corn, and the P is the potato is allowed, then the bro is not. So I see like everybody get the answer. So you can eat rice, but wheat, no. You can eat potatoes, oat, no. You can eat rice, barley, not. You can eat potato and corn. Therefore, this is the right answer. I can see a lot of people acing these exams. Congratulations. I like that. I like the spirit. NCLEX can give you that. That's what they do, you know. So rest in peace, bro. With the I is the C. Okay, so that's the way you do it. And the last question for the road, right? Last question for the road. 15 questions. Just a quick 15 question. And this is caring for a client on Selegiline, admitted for pneumonia. I'm trying to trap you. Think if you want to stay focused on the buzzwords. But which of the following diets the nurse should include in the meal plan? I'm taking Selegiline. I've been admitted for pneumonia. You have to order food for me. If you order something wrong, I'm going to die. So do the right thing. You give me 8 cheese, chocolate chips, favo beans, or ricotta. What do you think? Break it down. The buzzwords, use the buzzword which I've underlined. Forget about the pneumonia. And pay attention to this. Like I said, when I answer a question, I don't care. I just focus on the buzzwords. Selegiline diet, appropriate diet. So what should the patient, the nurse include? You have to figure it out. You have to figure it out. You have to make, first you got to recognize this medication. And I know you know. Do you recognize this medication? Selegiline. If you recognize it, then you know what it is. This is MAOIs. What should MAOIs avoid again? What should MAOIs avoid again? Tyramine. Which ones are tyramine? So you should avoid tyramine rich food. So I'm going to leave this answer choice. You should go find it out and email it to me. Tell me which one it is. If you don't know which medication it is, yeah, look at the answer choice, go research and see which of these has too much tyramine in it. And then, you can put it under this video, or you can just send it to me by email. That's what I want to do. I'm not giving you the answer. The last question, you got to figure it out. I give you half of the answer right. You also have to go find out. Is egg cheese is allowed? Is chocolate chips is allowed? Is fava beans allowed? Is ricotta is allowed? So go do your homework. You can take a picture of it. Take care of yourself. Thank you for sticking around. I'm not giving you that last answer. It's a 15, it's a bonus question. You got to do the research and find out which of these contain a lot of tyramine. Take care of yourself and all the best of luck. Thank you very much for sticking around. Adapt and